I'm Jolene Sheffield. I'm the Director of Customer Success here at QliqSOFT, and I've been running these Qliq University sessions throughout the year. Every month, we're getting together on a different topic monthly, and this month, our topic is understanding and conducting a needs assessment. So we're going to jump right into that in just a moment, but first, we're going to just go over the basic housekeeping rules of the Qliq University sessions. Essentially, I try to keep these sessions as brief as possible in respect of your time, so 30 minutes or less. We should all be out of here with a little bit more clear understanding of the topic. And I do mute all attendees just so that we can stay on track and stay focused, but my contact information is at the end so you can reach out if needed. And like I said, today we're going to be covering understanding and conducting a needs assessment. So let's go ahead and get started. I'll reintroduce the topic for our recording purposes, and we'll go directly from there. So again, welcome to the August session of Qliq University, Understanding and Conducting a Needs Assessment. Today's session is going to cover several different topics. And the outline, as you can see on your screen here, is going to cover what is a needs assessment, why are needs assessments important, 5 steps for successful assessments, leveraging secure communication, and then as always, we have that optional homework at the end. So the way that we've laid out the information today, we by no means are trying to tell you exactly how needs assessments should be done in your organization. There's actually lots of different methodologies, but what we have done is we've taken some of the best and most followed or adhered processes for needs assessments, kind of taken the best of breed, put in some input of our own, and we'll be sharing that information with you. And what we're going to go over really and focus on is those 5 steps for successful assessments. And then we're going to focus after each step on the various questions you should be asking yourself and your team along that process. Sometimes we forget to ask those questions, and that can actually lead to a lot of necessary information not being uncovered. So like I said, the way we've laid it out today is to make the point on the step of the assessment and then provide you actual questions to be asking along that process. So let's just get started right off the bat. What is a needs assessment? Essentially, a needs assessment is really just a systematic way of asking questions, comparing answers, and making informed decisions. You can see on this fun shirt here that I wish I had this in my wardrobe. As part of the planning process, a needs assessment is an evaluation aimed at bringing an organization closer to a target goal by analyzing gaps between current state and the desired future state. So a needs assessment can cover any topic that you want. It could be how to onboard new staff. It could be how to implement a new program. It could be how to reduce readmissions. Whatever it is that is a process or a product or a policy that you're wanting to improve, we're suggesting that a good, thorough needs assessment in advance will equip you to do that better. Why are they important? Really, at the root of it, it's so that you can work smarter and not harder. A proper needs assessment will help you identify the actual contributing conditions, get your buy-in, establish your key performance indicators, and really, in the end, hopefully have more successful outcomes regardless of what problem you're trying to solve. Many times, a needs assessment is initiated thinking we have one problem, and then when you actually get into it and start identifying those contributing conditions, you identify that the problem we thought we had really wasn't the issue at all. And I'll give you a very kind of far-fetched, loose example. I like it just because I think everyone can understand. There's a fictitious town in the U.S., the southern portion, that is experiencing increased drownings every time ice cream sales is higher. So they see that correlation. They say, hey, when we sell more ice cream, more people drown. We're going to have to fix this. And without doing a needs assessment, they just go in, decide to cut back ice cream sales, and expect to see a change in the number of drownings happening in their county. However, because they didn't do the needs assessment, they didn't actually identify those actual contributing conditions. They didn't involve the right people. They didn't get the buy-in, etc. Had they done that, then clearly they would have realized the actual correlation is you sell more ice cream in the hotter summer months, and that's also when people are swimming. So it had nothing to do with ice cream. It had everything to do with people accessing water activity. So that is a completely fictitious example, very far-fetched, but I think it demonstrates the concept really well, that if you don't do a proper needs assessment, you're going to spend a lot of time, a lot of energy, a lot of resources chasing down something that might not actually be the problem or the solution to what you're facing. So a needs assessment, a properly conducted needs assessment, will help prevent those spinning wheels, prevent that wasted energy, and give you a good structure to perform the assessment. As I said earlier, there are many various methods. If you just Google how to perform a needs assessment, you're going to find every consultant ever under the sun, every different methodology, everyone trying to tell you to do it a different way. And these 5 steps are my personal way of conducting a needs assessment. But each step serves a critical and distinct purpose. Whether you do a 5-step process or a 3-step process, there's even 26-step processes that I have come across. So long as the basics are covered, it doesn't matter if you do it in 1 step or 500 steps. You just want to make sure that you're hitting those core elements, and I've distilled this information down to just those core elements so that conducting a needs assessment does not have to be intimidating. If it is intimidating, you might be doing it wrong, or if it's intimidating, you might not even get started with it. So we want you to feel comfortable and know that conducting a needs assessment can really be as simple or as complex as you make it. So the 5 steps I have delineated here for you are: identify the business need, perform a gap analysis, collect appropriate data, collaborate and provide feedback, and lastly, develop your action plan. If I were to put a sub bullet there, I would say develop your action plan and then implement, assess, manage. It's an iterative process. So just knowing that if I were to put a step 6, that might be what I do. So you might create an action plan and implement it, and then come to find out you need to make some adjustments. So that should be, you should have that flexibility during and throughout the entire process. So now what we're going to do is we're going to take these 5 steps and we're going to break them down further. The first step is simply identify the business need, and these can come from anywhere. It could come from just a nurse on the unit that says, hey, we have this particular patient population that can't utilize these Foleys or these IVs or this durable medical equipment, and we need to evaluate a different process. It could be a home health worker that says, you know what, we are spending a lot of time and energy with all this paperwork, and there's got to be a way we can automate this process, and there's a business need that goes along with those driving factors. So some additional samples of a business need in healthcare might be that you want to increase revenue. You might want to decrease sentinel events. Why wouldn't you? You might want to improve outcomes or just enhance any process in your organization. So long as you can pinpoint what the business need is, you can kick off a needs assessment. So at that first step, step 1, you have several questions you should be asking yourself. So depending on your organization, depending on your level within the organization, depending on your company's culture, you might handle needs assessments with a very small team, or it could be a very large project managed team with a lot of different resources and timelines and a real project plan or scope around it. Or it could be a group of 2 to 3 of you that have been tasked with improving a certain process. So whatever the case is, whether it's a small project or a large project with a lot of finances and resources tied to it, you should still be covering these basic questions during that step 1 process. So what is the root problem? Can you answer that? Is this the right problem at the right time? We have lots of business issues to resolve, but sometimes it's not the right time to address a certain one. So for example, if it has to do with revenue cycle, and you have a large software migration coming up, is right now the best time to handle something to do with your revenue cycle practice management software integration to another system? It might not be, because you're going to get to that migration soon. You might have just been acquired by another organization, have some turnover, so maybe right now isn't the right time to address certain staffing issues. So you want to make sure that you're tackling the right problem at the right time. The next thing you would want to cover is, do you have the right resources engaged? To the extent that you can, you want to always bring the right resources to the table, especially if you're tackling a clinical issue. If you do not involve those frontline resources right out of the gate, you will spend a lot of time and energy developing a process that might not actually match their workflow whatsoever. And I'll give you an example of that here shortly. Another question, are we committed to completing this assessment? Do you really have everything in place and ready to take this on? It will take a good portion of your time if you're doing it thoroughly. And you want to make sure that if you have deadlines and timetables that you're trying to adhere to, that you actually have the ability to complete the assessment. Nobody wants to get 90% through a needs assessment and then not be able to implement any changes. And lastly, even though this has nothing to do with the business need, deciding what that business need is, it's never too early to gather metrics. And if you've identified that business need, then right then and there that day, that's when you want to start at least thinking about what baseline metrics do we need to prove results over time. We'll dive into that a little bit deeper when we get into the topic, step 3 of acquiring the correct data, but it's never too early to start defining what those data points might be early in the process. All right, step 2 is to perform a gap analysis, and really what that means is evaluate the differences, the contributing factors and conditions or discrepancies between what your current state is and what your desired future state is. So whatever business need, whatever issue you've taken on, you want to thoroughly map out what you have currently, including what resources it touches, what technology it touches, what processes it touches, what approvals would need to be obtained to make changes to that. You want to identify all of those areas during your gap analysis, and then ask yourself, what do we need to do if we need to make changes to that particular aspect? So some of those questions that you want to ask, first of all, is this a people, product, or process issue? And it could be all three. It could be a people and process, it could be a product and people, or it could possess aspects of all three. So you want to identify that early on in your gap analysis. Do you have baseline and best practice information? So what you don't want to do is you have your baseline. You know we see 40, on average, 40 patients through the emergency room a day, but we don't know if that's above industry standard, below industry standard. Are we following best practices? Have we researched that at all? So now during your gap analysis is a good time to start asking those questions. Are our objectives measurable and attainable? So as you're comparing current state to desired future state, you can start to see right off the bat, if you're trying to, let's say, engage a patient population that is does not have easy access to care, whether it's because they're in a rural area or it's a financial reason, but your objective is to get them all to have physicals once a year and have this level of engagement in their healthcare, and you're comparing your efforts or what you can do to those of a much larger or much more lucrative organization, you can see that right off the bat as you're looking at your objectives. Are they measurable and are they attainable? And if your goal seems too lofty, is there a phase 1 approach? Is there something that you can do in the next 30 days, 90 days, 180 days, or does it have to all be done at once? What are our actual needs versus our perceived needs? And this is really where having your stakeholders involved comes into play, because they will help you identify and understand what we thought we needed may not be what we need at all. We may have thought to improve this particular process of telephone follow-ups with patients, we might have thought we need to hire 2 more people. And that might be the road that we're going down. And then when we actually involve the people that are conducting those follow-up phone calls today, find out that they say, you know what, no, I'm not actually overloaded with work. It's not that we need more hands on deck. It's just that I need to streamline this process, or whatever the case is. Having your stakeholders there at the table will help you delineate between those actual and perceived needs. And last, are there budget implications or constraints? So is this going to cost us something, or is there something we can use in the meantime? When you're doing a current state to future state, you want to start gathering that financial information early on so that at the end, along the way, you can speak to the ROI that you will have, the return on your investment, and in the end, in retrospect, you can go back and you can prove that ROI as well. So you need to know if you have a budget to work with, if you don't have a budget to work with, if your budget is small, large, whatever the case may be. The third step is to collect appropriate data. So not all data is actionable, not all data is accessible, and not all data is even necessary. Your data should support the process. I cannot tell you as a project manager how many times I have been involved in projects where our stakeholders were tackling this specific issue, and our stakeholders come and we got to know how many patients, we got to know how quick the throughput, we got to know and it has nothing to do with our actual problem, and you spin your wheels trying to create and collect all of the data under the sun, when really what you should be driving towards are data that supports your issue, data that supports your solution, data that allows you to measure against your key performance indicators. So that's really the first thing. What KPIs will measure success? If you have not established your KPIs yet, now is the time to do that. So how will we know 6 months after we implement our solution? What can we stand back and look back and say it was successful, and we know that because we saw 5 more patients on average, or our home health aides were able to turn around timesheets that was taking them on average 2 weeks, and now they're doing it in 3 days. What is the KPI, the key performance indicator, that you can point to in retrospect to say, this is how we know we were successful? So establish those right now. Second, do we have reports or the means to obtain data? I've been involved in so many projects where there was a specific actionable data element that we needed. We needed to figure it out. It supported our KPIs. It would help us measure success, but there was no way to obtain the data. Either we didn't have access to it, or it was not discrete data. Maybe it was free texted information in the EHR, or buried in some data management warehouse that you just could not get to it. So do you have reports you can leverage now? Do you have a means to obtain data? Do you need to befriend somebody on the data analytics team and pull them into your project? So do you have resources capable of analyzing and performing data visualization? Data visualization is not required to do a needs assessment, but you'll find anytime you can take some data and really make it pop and really give it some graphical interface to present to people, it allows people to digest that information and understand it a lot easier. A picture is worth 1,000 words, absolutely. And when you're talking numbers, anytime you can do visualization, that's obviously preferred. So do you have a resource who can do any of that for you? Even if it's just a simple pivot table in Excel or a pie chart, it doesn't have to be Tableau or some other system that is really, really designed for that. Just, do you have the resources capable of analyzing and performing that task? Do you need to report the data out, and to who? And what data will have the most impact? So you might, aside from your KPIs, you might find other data that, while it doesn't speak to the success you've had, it really demonstrates the problem. So there could be factors that don't change as you implement your solution, and those particular numbers persist, and that can help reinforce the fact that there's a more pervasive issue. So really getting to the core of data and not waiting until the end of your needs assessment is absolutely critical. Step 4 might seem a little obvious: collaborate and provide feedback, but it is not so obvious. There have been numerous, even governmental programs where they have spent large sums of money to evaluate a process, design a solution, and go implement it, only to come back and find out that the people doing the work were not involved. There was no collaboration, or they completely disagreed with the approach, and now you're in recovery mode trying to loop back to those people, get their input, redesign your solution. So having that collaboration and feedback up front is incredibly important. So some of those questions you want to ask yourselves: have we heard from everyone? And that's not just a, do we have the right stakeholders? That's even outside of our stakeholders. Have we gone out and looked at the process ourselves? Have we asked other people to validate what our stakeholders are saying to us? Are we getting opinions, or are we getting facts? Have we heard from everyone? Have all solutions been considered? Part of the needs assessment process, the solution does not come from one person. So you identify your business need, you do a gap analysis where you are and where you want to be, and you get your data, start working with all of that, and people start throwing out ideas for, well, if we just opened the office an hour earlier, we'd be able to do this, or we'd be able to take in more patients and see better outcomes if we had a CHF clinic on the weekends, and that would help reduce readmissions through our emergency department. But unless everyone is collaborating and throwing those ideas out there, you're going to miss some really good solutions that you might have to spend a little time drawing it out of people on your team, but it's worth it in the end to be able to look back and say, we really took a comprehensive approach to this and we considered every angle. Another option, is there a parallel opportunity? So do we have an opportunity here to run 2 plays simultaneously? Maybe we have a problem and we're not 100% sure on the solution, or we've got 2 competing solutions that are both good ideas. Can you do both? So start to ask yourself and consider that. Can you clearly visualize your plan, or do you need clarity? At this stage, by step 4, you should be able to clearly visualize and speak to the plan. And last, are the right players on the field? I'm going to give you an actual example. I've spoken to y'all numerous times about my work background. I worked for one of the largest healthcare systems in the United States, and I reported directly to the CMIO as part of the informatics team. And one of the projects I remember taking on very early in my career there was a scheduling task. So we had a department, a high volume surgical center that was really struggling with scheduling patients, making changes to schedules. Cases were getting delayed, things like that. And there was always a holdup, whether we didn't have the consents, or we didn't have the orders, or the physician hadn't signed a history and physical update, or whatever the case may be. There's all these prerequisites that went into the scheduling process. And early in that project, we identified the issue, we collaborated, we thought we had all the right people involved. We never involved the one person who was sitting there doing the scheduling. Her supervisor was represented, she was not, and that really ended up coming back to bite us, because she had her own ways of doing things, her own workarounds, her own manual efforts that her supervisor really didn't even know. Processes she had developed to keep the wheels moving and to do good work, and she did great work, but because we didn't involve her, we didn't identify those things, and we really had to go back to the drawing board. So making sure that you have the right players on the field, frontline, back office, revenue, whatever the case may be, making sure that everyone is on the same page. Not only does it help you avoid those costly mistakes like we made, but it also kind of gives you that buy-in before you even get started changing a process. So if people know you're about to change their work and the way that they do things, and you just kind of thrust that upon them, they're going to react one of 2 ways. They will either reject it, or they'll accept it, and they may accept it begrudgingly or gleefully, who knows. But unless you've involved them, you don't know. And if you have involved them, then you've already obtained their buy-in and they're witnessing the process to see that you really have their best interests at heart and that their needs are and wants and desires are represented. So incredibly important question to ask yourself there. Step 5, develop your action plan. So one thing I would say to you right off the bat is it does not have to be formal. It doesn't have to be, written up and signed off on by all of these different levels of management, unless that's your process at your organization and you have that type of red tape to deal with, which I've certainly been in that position as well. When you're developing your action plan, to the extent that you can be flexible, you should be flexible. You should have risk mitigation. You should have backup. You should know what you're getting into. Have a backout plan. If you're implementing a new software, maybe a new EMR, a new PAC system, something like that, and your action plan is to implement this product, do you have a rollback plan? Do you have downtime procedures? Do you have everything in place? Probably not. We're going to overlook a lot of those things. It happens. It's human nature. But if your plan is flexible, then you can kind of make those adjustments as you need to. So some questions to ask yourself during that phase and really that last phase of that needs assessment is, what can we change versus what can we control? So some things cannot be changed, but they can be controlled. We can put policies in place. We can put protocols around them. We can limit access to things. And some things can be changed. Maybe you do have the means to implement that new software that's more expensive, or to do, completely change your wound vac system, and your current one you were using had all these issues, and so your plan is just to replace them. That's possible too. So identify what can be changed versus controlled, and sometimes that controlled section is where you can find some room in your budget to save money on your project as well. What training will result, and are we prepared for that? I can't tell you how many projects I've been involved in where we get this great plan going, or I come in at the last end of a project ready to go do implementation, and then they're like, well, how are we going to train everybody on this new process? And it hasn't even been considered yet. So definitely it should be something you're thinking of very early. And by step 5, you should be reinforcing the concept with your team that you have a training plan, or you're prepared if there is a training need as a result of your changes. Is your timeline and your objective clear? We've said that a couple times, but it's very important even at stage 5 to make sure that you know, and you're circling back to, here's our objectives, here are our KPIs. We can all speak to this. We all know what the outcome should be. And that way, as you start to see changes and impacts of the solution that you implement, you can clearly attribute them to the project. Have you documented the impacts? Have you documented the risks? If not, you should probably pause right there and get that done, because the impacts and the risks can become very critical in the event that something just doesn't go right. And you need to do a retrospective analysis of what work has already gone into your project. So knowing the impacts, documenting those, who all it touches, knowing the risks, having a mitigation or a backup plan for those risks, all of that is necessary really prior to developing and finalizing that plan. And last, I mentioned that sub-bullet at the beginning. Are we ready to implement, evaluate, and manage? You're not just going to develop an action plan, push play on it, and everything just runs smoothly and you never revisit the topic. You're going to develop your action plan, you're going to put it into place or implement it, and then there's going to be a period of evaluation where you're seeing, where do you sit with these metrics? We're analyzing the data again. We're going back and checking against our KPIs. And then you're going to manage it. Do you need to make a change? Does something else need to happen? Are you making the progress that you thought that you would make by that stage? So really, it's not just green light and go. It's implement, evaluate, manage. It's a flexible, iterative process. So at this point, you might wonder or ask yourself, what does this have to do with secure communication? Why is QliqSOFT even involved in this? Why do they care if we know how to do a needs assessment? Where's the benefit here? And what I can tell you is that $62.4 million is a lot of money. This is a study that was done. I'll link it in the follow-up after this session, but the study showed that large companies, it was about 400 companies with over 100,000 employees, so you're talking very large companies there, but on average, poor communication resulted in a $62.4 million loss annually for those companies. And you might be thinking, okay, well, we're just a little mom and pop shop here, we got 50 people or 20 people. They did another analysis, another study of smaller companies averaging 100 employees, and they were able to identify that poor communication or miscommunication led to about $420,000 of lost revenue or opportunity per year. So communication is key, and we are a secure communication company. So our customers, you and the rest of our customers are out there utilizing our products and doing your day-to-day operations. And we know that at some point, when you start to do a needs assessment, when an issue comes up at your organization or a process is brought to your attention that needs to be improved, and you start to evaluate it, it is highly likely that you will find communication or poor communication to be a key contributing factor to the negative situation. So it will either be a key contributing factor to what is happening wrong, or it needs to be a key contributing factor to the way that you change and do business differently. So that's really where we come in, and we just wanted to present this information to you and let you know that as you come across those projects and those initiatives and you're doing a needs assessment, we are here to support that process. So we have professional services, people in the customer success department, such as myself, that can be contacted. And if you say, hey, you know what, Jolene, we have this particular process where our, let's just use a cardiac example. So there's a patient that's just undergone what's called a TAVR procedure, and those patients they're a little different than your other cardiac surgeries, and they needed a little bit different type of follow-up, and this is how we're handling them now, but this is how we want to handle them in the future. And we think that Qliq or secure texting or image capture or document capture, we think these things will contribute to or be a part of our final output, or we've identified this in our needs assessment. You can always contact us, and we can and gladly do become stakeholders on project plans with our customers, and we serve on committees and do various things, and really just be a vendor representative to the conversation to make sure that if your solution is, well, we'll just use QliqSOFT and do this particular workflow and that will solve everything, but then you come to find out we don't have that feature, or that feature works differently than you thought, you'd have to come back to the drawing board. And we want to avoid that. We want to help you be successful in implementing any initiative involving secure communication. So as you perform these needs assessments, having the tools, having the information now at your fingertips, and you'll have access to this presentation and this recording as well on our website. If you get involved in a needs assessment and come to find out there is a communication component or a collaboration component or a lack of either of those, and you would like some assistance with that project or with representation of the business need, we are here to help you with that. So that's kind of what broached the topic for us. And I have two specific examples of our existing customers where they did perform needs assessments, and we did get involved and assist them with developing a process to resolve their issues. So one, we had a hospital or a healthcare system really who was having a decrease in their satisfaction scores, and they did a needs assessment. It revealed that the patients, the core question they were failing on those surveys was, do you feel like your provider clearly communicated with you on your condition, on your treatment plan? Did you feel like your care team collaborated, et cetera, et cetera? And they were really missing the mark in that area. So their solution initially was just, well, we'll tell the patients we're collaborating. We'll just make sure that they know we're doing that. But unless the patient really felt engaged and saw it for themselves, they still struggled. So they came back to the table. And we worked with them and implemented a process of multidisciplinary rounding on the units in front of the patients with all different care team representatives present, whether it's physical therapy, your nurse practitioner, the surgeon, lab, pharmacy, social work, everyone there with their computer. And if they could not physically be there, we developed a process for them to use Qliq Secure Communication to engage members of the care team that weren't physically at the elbow and have collaborative group conversations with them and share information with the patient. And by doing so, they were able to really improve their hospital satisfaction scores tremendously. And so they definitely attribute that to the improved process. Another example, we have a home health agency in the Southeast. I always have to think about that. In the Southeast that was impacted by a hurricane, and it shut down their phone systems, all telecommunication, all radio, everything. And they realized, unfortunately, too late, because it's already happening to them, that they did not have a good disaster recovery communication plan. So we worked with them. We got on that project. We were represented in every team meeting. We spoke to what our current state solution could do. We actually even adjusted our product a little bit to incorporate some other features that would be really useful. So that's another kind of benefit to involving us in your needs assessments, is if our product can't do it now, but we can make a really good, strong case for it, it could do it tomorrow. So we made some changes and adjusted things and helped them develop a secure communication, disaster communication plan. And they were able to quickly, they quickly became really adept or really strong at implementing the disaster communication plan that we co-developed. And they used QliqSOFT for that, obviously, as they realized that secure communication on a mobile solution that had to do with cellular towers and not beholden to Wi-Fi and not required to be a landline. They realized that in their gap analysis. That's where we came in, and we turned that product around a little bit and made it more user-friendly, more useful for that situation, and they began utilizing it. And unfortunately, they had another hurricane situation about 2 years later and were able to use the plans that we had co-created, and it went very, very well. So those are just two very basic examples of how we might get involved with you or your organization if you determine through your needs assessment that there is a secure communication or collaboration component to the issue. All right. I know I just threw a lot at you in just a little amount of time. We do not have homework this month, so normally I would send out a different type of informational or a video or a blog or what have you. This month we're not doing that because the takeaways really are the presentation. All the information you need is there. It will be on the website. You go to QliqSOFT.com/QliqU, or QliqSOFT.com, go to resources and then Qliq University. And you can go to the August session, and in about 48 hours, you'll be able to see a recording of today's session and the presentation itself. So that'll be there for you. So no optional homework, just reach out to me if you feel like you would like some assistance in a needs assessment or a project that you're planning or a use case, and we can engage, absolutely. And the other thing I wanted to point out before I let you go, October, we're going to be doing Qliq University focused on artificial intelligence in healthcare. Obviously, September comes before October, so I'm not trying to skip over September, but this particular session is already quite full. Artificial intelligence in healthcare is already quite full. So it's going to fill up very, very fast, and probably within the next week or so. So I just want to encourage everyone to reserve your seat to that session today, because we are going to talk about artificial intelligence, what it is it just ones and zeros? What is NLP, natural language processing? What is Qliq doing with artificial intelligence? What's our plan and our forecast for our industry with regard to artificial intelligence and things like chatbots? So I strongly encourage everyone to attend that session in October, and I don't think you'll be disappointed if you do. And that's all I have for you today. Again, I know I threw a lot of information at you. If you'd like more information, if you'd like to reach out about partnering on a project or any other initiative, simply email me. My name spelling might be a little odd, so I'm going to leave this page up as we close today, but it's jolene.sheffield@qliqsoft.com. I do have a clinical background as a paramedic for quite a long time. I do have over 10 years in clinical informatics and health IT. I do have project management experience, so I am poised and ready to assist you in any facet of your evaluation. But we definitely believe strongly that communication, and more importantly, secure communication, will play an important role in any process improvement project that you undertake via your needs assessment. So I hope that this was useful today. I hope that you got as much out of it as I put into it. And please, please reach out to me if you have any questions. And I will see you all at the September session. Thanks. Have a great day.